Good afternoon, guys. I hope we're all sparkly. C-dip done. Been to the gym. Ran the dogs. And back to emails. Endless emails. What should we talk about today? Let's talk about the menopause. A term coined by the press. Does it accurately reflect testosterone deficiency? No. Menopause. I suppose it's been coined because they want to compare it to the menopause. A well-defined time in a female's life where she stops menstruating and no longer produces eggs. Her estrogen level drops, her testosterone level drops, progesterone drops, and she has negative symptoms as a result and a negative health outcome because healthy hormone levels are healthy hormone levels. We should attain healthy hormone levels for life. Now, the menopause. Testosterone deficiency can affect anyone. Now, is there cessation of testosterone production? Well, the answer to that question is no. Now, if you were born with no testicles, or they were removed, you will still produce a small amount of testosterone from the adrenal glands. The testosterone deficiency syndrome, bad word really, testosterone deficiency, can happen as a result of a pathology, which can result from a primary cause, which is testicular, a secondary cause, which is from the brain, so the LH and FSH is not being sent down to the testicles, and it can also happen from a tertiary picture, which is more to do with prolactin inhibiting LH and FSH. This is what the NHS recognise. What they're struggling to recognise, but are now finally recognising, is functional hypogonadism. Now this is as a result of life, lots of exogenous stress, poor sleep, poor diet, lack of exercise, anabolic steroids, alcohol, recreational drugs, opiates, antidepressants, the list goes on. So much like hypothyroidism, low thyroid, you don't always find causation. Now, the insidious changes that happen are insidious. They creep up on you. There's not normally a pre-testosterone level and post-testosterone level for these events because you think it's all part of life and you're cracking on. And we don't really tend to screen for testosterone deficiency because it's not well understood. Now, you'll go to your doctor and have your testosterone levels checked and you'll be told they're within range. But doc, are they optimal for me? I don't know. How do you feel? Well, I've presented with low mood, so I'm sure you can understand that I don't want to have a low mood. Well, we can sort that out with an antidepressant. Well, I've presented with tiredness. Well, get some sleep. I've presented with brain fog. Oh, I get muddled thinking sometimes too. Get some sleep, eat properly, do all the things that you need to do. Low libido. I've got a solution for that, the little blue pill. So what should we be looking to do? Well, yes, you know, we should be looking to address causation. Now, disappointingly, there's no money in correcting hormone deficiencies. Sad fact. Follow the money. The pharmaceutical industry is a business. You must remember that. The NHS is literally firefighting. There is toxic overcrowding. There is lack of resources. There is disillusionment within the medical profession because every doctor, every nurse, every paramedic goes into the profession wanting to effect a positive change to society, to humanity. And when you become another cog in the machine, and you realize you can't affect a positive change because the model is broken, you become disillusioned. These poor GPs, honestly, I do feel sorry for them, because I was a GP before. 20 patients in the morning, 15 in the afternoon, ranging from trivial sore throats to cancer to social problems. You've got 10 minutes. Well, we had 7 minutes in my previous practice. It was, and you walk in looking normal, your testosterone levels are fine. Crack on, but you don't feel fine. So, go on, do all those things that you need to do. Sleep hygiene, stress reduction, exercise, and nutrition. And you should do all those things, because testosterone deficiency should be a diagnosis of exclusion. We shouldn't want to commit to daily injections for the rest of our life. Now, lots of people do think that testosterone replacement therapy is a lifelong therapy. And it should be considered a lifelong therapy, because why would you be going on it if you didn't need it? So, what would happen if you came off testosterone? You die. No, you don't die, for the love of God. So what is testosterone? Testosterone is an anabolic hormone. Its primary role in our body is growth and repair, repairing from activity stroke catabolism. It's all about how you feels. It's not about how you feels. It's about normalizing physiology. So if you come off of testosterone replacement therapy for whatever reason, but why would you do that? I suppose if you didn't see the positive effects that you were wanting, if you didn't have the finances, because it is expensive, well, what's going to happen? Well, if you've been on HCG, and as you guys know, our gold standard testosterone is testosterone, cypionate, and HCG, you will have preserved testicular function. So that journey back to where you were before won't be so arduous. If you've not been on HCG and you've just been on testosterone monotherapy, you've essentially shut down the production of LH and FSH from the hypothalamus and pituitary, and the testicles will have atrophied. So your journey will be a little bit longer, but you will recover. Recover to, if you stop 10 years later, where you would have been in 10 years. But you started testosterone replacement therapy because you had negative symptoms and your physiology was negatively impacted. So surely, well, perhaps you can rationalize that you've changed all the things that caused your low testosterone. And there is an argument for that. You could go, right, well, my sleep's now in check, my diet's now in check, I'm exercising. Well, why are you doing that? Well, we talk about testosterone being a foundation hormone, don't we? So testosterone's giving you that foundation. Some of my patients, the younger ones, have trialed cessation. I'd say a small proportion have been successful. Well, they haven't contacted clinic again, but the vast majority of patients go, Doc, I want to go back on. I didn't realize the positive effect of testosterone replacement therapy on my sense of well-being. Because what's important? Yeah, you guessed it, now. How you feel now, not your memory of XYZ. If you're chasing that, how do you feel at 16? Happy, horny, and ain't gonna happen, because now you're 30, 40, 50, and life has just gone. It's all about appreciating the moment, living in the moment, being mindful of the past and mindful of the future, and making good choices to affect a positive outcome to you, to me, to everybody. So, testosterone deficiency is a complicated field of medicine. The NHS has little interest. The pharmaceutical industry has even less interest. And the media follows the money. simples. So what's it down to? You have to effect a positive change to your health through understanding your physiology, how your body functions, looking after your stress, looking after your sleep, whatever I bang on about all the time. Repetition is key in a world full of distraction and over-sensualization of nonsense. Concentrate on what's important. You, me, everybody. All right, guys, have a good one.